Welcome back, West Michigan. You are watching Alive and Well. I'm Lynda Balkema, and with me is Dr. Julie Willem-VanDijk from the Population Health Institute, University of Wisconsin, Madison, correct?
That's correct.
All right. We've established today that we own Lake Michigan.
That's right. I now know Wisconsin has no claims on it.
Well, we do have the beautiful dunes on our side.
Right, and we have the beautiful rocks.
You have the beautiful rocks and the beautiful breweries. We talked about that.
We did.
Although at one time we were the beer tent capital, so I don't know.
Okay, well, we're in competition.
Anyway, yeah, we need to get rid of that. So tell me about the project.
Sure. Well, I'm here working on the County Health Rankings, and the County Health Rankings is a project that measures the health of every county in the United States every year. So it's kind of like as individuals, we go see our doctor every year for an annual health checkup. The County Health Rankings provides communities with an annual checkup of their health. And one of the things that's really important about the County Health Rankings is it helps us see that health is more than health care. So how long we live and how well we live is really determined not just by access to and quality of medical care, although that is important, but even more important is our health behaviors, our social and economic factors, and the physical environment. So we put this data out there to help communities see how they're doing compared to other counties in their state. They have an opportunity to look at all the individual data and say, here's where we're doing well and we need to keep doing good things. Here's where we're falling behind and we need to work together as a community to improve health in those areas.
Yeah, and I know Muskegon, especially our 1 in 21 collaborative, has used a lot of that data to drive forward our initiative to become the healthiest in the state by 2021. That is our goal, and it's a lofty goal, but not totally impossible. We know our neighbors, Ottawa County, have been number one. I think they dropped to 2 or 3 this year. But, you know, that's what we want to work towards with our healthy bike paths and a lot of different things. Now, in the rankings, I know there was a lot of talk about weights today, and I'm not a scientist, and I am not a data geek. I'm not good. I'm learning. Right. So explain to me exactly what weighted means.
Well, what weights mean is when we go to look at each individual piece of data in the rankings, we have to decide, do we weight them all equally and say all 29 pieces of data are 1/29th of the total? Or do we look at it and say, we know some elements actually contribute more heavily to those health outcomes of how long we live and how well we live than other elements? So in the county health rankings, we look at mortality and morbidity, or how long you live and how well you live, and those are our health outcomes, or a picture of today's health. And in that area, we weight how long you live and how well you live equally, because we figure it's good to have a long life, but it's equally good to make sure that's a high quality life. Then we do a second set of rankings looking at the health factors, or those elements that contribute to how long you live and how well you live. And there's 4 key health factors: health behaviors, social and economic factors, clinical care, and the physical environment. We weight those quite differently, and that's based on looking at the research, looking at expert opinion, looking at history, and what we know has contributed to health outcomes. So we actually weight social and economic factors the heaviest. 40% of the health factors ranking goes from social and economic factors, followed by health behaviors at 30%, access to and quality of clinical care at 20%, and the physical environment at 10%. Now, they're all important. They're all very important, but we think this is really close to what is the relative contribution to how long you live and how well you live. And the other thing I think is that can help you think about where you want to take action. So, for example, the project I'm here to address and sponsored my attending this breakfast this morning is Project Healthy Grad. And it's an effort in your community to look at how to improve high school graduation rates, how to improve health of students. And that's really very important because we know education is in that social and economic factors that weights 40%. And if you can improve your educational outcomes, you will ultimately have a higher impact on your health outcomes than perhaps even increasing access to medical care. So I don't want to set it up that it's one is better than the other or only one is important. Everything is important. But as a nation, we have put about 95% of our resources in that area of access to and quality of medical care. and much less resource in those other areas. And if we really want to improve the health of communities over the long run, we need to start thinking about how do we focus not only on getting to the doctor and seeing the doctor, but how do we help people make good, healthy choices every day? How do we create environments where it's easy to do that? So, for example, when you go to the school lunch program, how do you make sure there's a salad bar and fruits and vegetables there for the kids to eat? If there's only corn dogs and French fries, that's what they're going to eat and that's what they're going to learn. But kids are great. If you teach them about fruits and vegetables and make it fun, they'll eat it. And if they start eating it when they're children, they're not going to have that vegetables thing as they grow up.
Spinach, asparagus. I think one of the things when I was a kid, I remember that spinach and asparagus was so overcooked, we just, that's what we did. But now
we had to eat your vegetables. I
Had to.
remember,
Yes, we did.
bartering with my mom. How about only 5 bites?
I did that with liver.
Yeah. So how do we create healthy food in a way that's appetizing and appealing and easy to get to? How do we change what's in our vending machines so that it's not all chips and sugar? How do we, one of the strategies we know works in work sites, for example, is to create competitive food pricing. So your workplace cafeteria might still serve cheeseburgers and fries, but that costs $10 and the salad bar costs $5. So now there's a price incentive to eat healthier too. It's something employers and some school districts have done around the nation, and we know it drives people making healthier choices.
That's an excellent point. We need to do that, and I think more community gardens, because to make that viable right now, it costs more to eat healthy, and that's just wrong. That's what we need to change. It shouldn't cost more to eat healthy, to get fresh fruits and vegetables. If we grow locally, produce locally, we can start sharing that locally, and everyone can benefit from that.
Absolutely. That's very important.
That is. I like that. So with Project Healthy Grad, of course, in 2 of our schools, we do have 2 community health workers but from AmeriCorps that are in there to do that, to do some health education, to help students that need enrollment get enrollment. But importantly, your website you shared with us today can teach them a lot of venues or avenues of how to create some education in the schools, to reach out to those kids that might not be getting that education at home about how to eat healthy.
Right.
Okay, I have to ask, off topic here, who, number one in the state, who is that? We want to know, who are we really supposed to be? Which state has the best health right now?
Which state?
Which state and which county? Can you,
I cannot tell you county overall in the nation because we don't do that analysis. I can tell you the healthiest county in each state, although I didn't look. I think Michigan's Leilani, isn't it?
Leelanau.
Sorry.
That's okay.
Yes, that's the healthiest county I think in Michigan this year. I'm sorry, I did not.
That's
look
okay.
that up.
I think you're right. I think Leelanau is, but which state in the nation?
The state in the nation that's the healthiest is Vermont.
Vermont. Okay.
And the unhealthiest state, according to America's Health Rankings, is Mississippi.
Mississippi. And there's a great video we can look at on your website about Mississippi that they've really made some strides.
There's a community in Mississippi that has really taken on health improvement. And so I think it's a great testimony that it doesn't matter where you live. If you live in the healthiest county in Vermont or the unhealthiest county in Mississippi or anywhere in between, there are things your community can do. Every community can get healthier. I mean, even in the healthiest communities in every county and every state, if you look at their obesity rate, there is room for improvement. I think the best county I've seen has an obesity rate of 15%. Well, how is it that we'd look at that and say that's okay?
Yeah, I know. Yeah,
I mean, there's many that are up in 30 and 35%, but still, we have room to improve on that everywhere in our nation. Likewise, smoking rates have gone way down, and so instead of 1 in 3 people smoking, we're down to 1 in 5 or 1 in 10 in some communities. But we can get to 0% tobacco usage.
And that's interesting. Let's talk a little bit about the effectiveness and how that has happened. You could just look at what's happened with tobacco over the past few years, the messages that came out. Tell me how you...
Sure. Well, in my lifetime, I remember when everybody smoked everywhere.
Right.
You've come a long way, baby. We encouraged women to smoke so they could be more like successful men. But in 1965, the Surgeon General made the first official warning linking tobacco use to cancer. And from that time, and so we saw an initial drop in tobacco use with people who were scared by that and thought, ooh, I better quit doing this. But then we saw plateauing for a long period of time. And what we learned was you really have to change environment to change tobacco use. So some of the strategies that have been used throughout the last decade or so to really see that rate reduce is, number one, tax cigarettes, so they're more expensive. We know, it's the same thing like I talked about with the food. Things that cost more are less likely to be purchased, and especially in tobacco, they were less likely to be purchased by young people because teenagers don't have as much disposable income. And we also know if you don't start smoking in your teens, you're probably not going to become an addicted smoker. Most of the time, if you make it into your 20s or 30s, you don't pick up that habit then. So price, big thing. And then the second big thing is making smoke-free environments. When I was a young nurse, I used to go into patients' room and turn off their oxygen so they could smoke a cigarette in bed. When I talk to young nurses these days, they think I'm a dinosaur. They can't imagine a time when anybody smokes in a hospital at all.
Teachers smoke.
Teachers smoke. Professors smoked. Professors used to smoke in front of their classes in college. And, we started with eliminating smoking in public buildings, in hospitals, and schools. And now, of course, many, many states have taken the action to just ban smoking because of what we've learned about the hazards of secondhand smoke in all work sites, public places, restaurants, bars. So, and the result of all this is we've seen dramatic reductions in tobacco use.
And the marketing now, if you see some of those shocking commercials, and I know they're shocking, and some people find them offensive, but let me tell you, my father had throat cancer and lung cancer, and he actually did have a stoma and had to speak with a collar. And so those shocking commercials, I know my son said, oh my gosh, if that doesn't make me quit, I don't know what will. And darn it, he better. We're working on that, but it's an ongoing battle, and it's an addiction, so we've made great strides. Now the challenge is, how do we do that same thing with obesity? Because you can't take food away, and that's a tougher battle.
It is a more complex issue because you can't just say no to food. Right. But there are many things we've learned and from tobacco that can be applied to obesity prevention. And I think a big part of it is some of what we were just speaking about in terms of changing environments. So if you make it more healthy food friendly, if you also make it more easy to exercise, a really effective, really inexpensive strategy is called pointed decision prompts. And that's where you just put signs up in places that's like by the elevator that says, take the stairs and burn calories. And people have found when you put signs like that there, people will do that.
I love that idea.
Yeah.
We need to do that. We're going to get those signs all over Muskegon.
All right. And so, you can do anything from really simple little things to things that are more interventionist in terms of, there's a lot of controversy around how you use public policy in terms of obesity, about whether you do ban certain foods, and there's a lot of room for discussion about that. But even if you don't go that avenue, there's many things you can do in our own homes, in our own schools, in our own work sites to work on this issue. And I really want to commend the people of Muskegon for the work you're doing in this area. I wish I could have been here last weekend for your great walk and run and see 2,900 people out there engaging in physical activity. I've heard many people who've never exercised very much before were part of that walk, and that's really what we want to do, is help encourage families to exercise together, people to be out moving together. How do you build on that and have a weekly walking club? How do you change your trail system so you can use this beautiful environment you have so it's easy for families to go out and ride their bikes together and safe for them to do that and walk? And, each of those steps will lead you towards a healthier Muskegon County.
And we are. So Mercy Health Partners sponsored the walk, the Seaway Walk this year, walk and run. It was a 5K and a 15K run and also a walk. And prior years, it had been sponsored by the Muskegon Chronicle, which has now kind of become MLive. We still have the Chronicle, but it just wasn't there. So Mercy took that up, and I'm really proud to be a part of Mercy Health Partners. It was my first year in that Seaway run. I did the walk, but I can tell you next year I will do the run. I'm going to do the 5K. I've been a power walker for some time, but what a great event. We had, in the past, there had only been 200 walkers. They had 900 walkers, and then total, there was 2,900 people, so 2,000 runners. It was a great event. And we need more things like that in Muskegon County. One last thing, as we talk about obesity, that's one of the risk factors. Diabetes is another risk factor. Substance abuse, that's another big problem here in Muskegon County. What are some of the effective ways to address the substance abuse issue?
Sure. Well, there are many things that we can do around substance abuse. Again, many times substance abuse starts in the youth years and is most dangerous in the youth years, especially with what we're learning about the effect of alcohol on still developing adolescent brains. So there are strategies like working with informing parents about the dangers of hosting parties at their home. There have been communities that have started to put ordinances in place that would hold parents who host parties where alcohol is served more liable for any accidents, any injuries that would happen. So there's certainly laws you can have around controlling that. We also know access to alcohol is a huge issue. So looking at how easily available alcohol is and potentially putting policies in place that restrict sales at certain hours, restrict volume that people can buy, restrict how many liquor stores are present. We know one of the most effective strategies in terms of drunken driving is having checkpoints, sobriety checkpoints. Now, I know a lot of people don't like that. They feel that's an infringement of their liberties. But if you really want to be effective in curbing drunk driving, that is one of the most effective policies, because people are less likely to drive drunk if they think they might get caught any time or might get stopped and checked. So I know it's a controversial strategy, but it is a strategy that certainly is shown to be very effective in reducing drinking and driving. And another last strategy I'd mention is really working in partnership with your alcohol establishments, doing responsible server training, helping, most bartenders really don't want to deal with people who are completely intoxicated. They're difficult to have in their establishment. Sure. So how do you empower them to know when to say no to serving and how to assess for when someone may be too intoxicated to...
And I have to say, we do have that program in place. I want to thank Laura Fitzpatrick from our office. She has headed up the Drug-Free Coalition, the Ally Alcohol Liability Initiative, and they have worked very strongly on some policy changes. Right. There was a terrible accident. Sometimes it takes a tragedy to initiate some of this change, and there was a very accident a few years back in the Reeds Puffer District that really set this motion forward and really involved one of the local stores that had sold to minors, and so they got on policy about that, and they've taken a lot of action, a lot of training in that area, but there's still much room for improvement. Muskegon has a ways to go. We have a ways to go in our health rankings and just to be a healthier community. And what you have done here today, I just thank you so much for coming. We had a wonderful conversation last night at a dinner. Great community involvement here today. Is there any closing remarks that you'd like to tell our viewers, and tell us about your website again so they'll know how they can look up information?
Absolutely. Our website is www.countyhealthrankings.org. You'll not only find all of the data about Muskegon County there, but you'll also find on our County Health Roadmap section a number of tools and resources to think about how you can move forward as a community to improve health in your community. And I would just say it's been a pleasure being here. I'm very impressed with the leadership and the people here who are taking action to improve health, and keep going so that you are 1 in 21.
Yeah, we're going to try that. And Julie, thank you so much. I hope we can have you back next year and see where we've come in a year.
Great.
Thank you.
Thank you.
Thank you, West Michigan.